tonight, 3 wonderful programs, but that gives us more time for Q&A. So the programs will have about 5 minutes to present, and then we'll use the remainder time for our Q&A session. So the programs that we have with us tonight are University of Texas Health Science. Oops, excuse me. Let me go back. There we go. University of Texas Health Science Center, Pediatrics at the Joe and Teresa Lozano Long School of Medicine, UT Southwestern, and UT Austin Dell Medical School. We are so happy to have you all with us tonight. All right, and let's see here. That's just a reminder for the Q&A. And first up, we have University of Texas Health Center, Health Science Center, Pediatrics.
UT Health San Antonio will do.
There we go.
That is, thank you. Thank you so much for the introduction. And sorry you guys get stuck with me and my voice again for a consecutive time. But I'm excited to be here. I'm excited to see the familiar faces of program directors from other programs around the state. Joining me from my program, just for reference, is Gina Akersberg, who is our chief of residence. She's a junior faculty chief this year, and she is a wonderful, wonderful, wonderful person to have in my corner. So I'm glad she could join us today. We obviously are a program in the Southwest region. We are in San Antonio, which, as I mentioned earlier, is quite smack dab in the middle of the hill country. And really, you know, again, the slides kind of speak for themselves. I think there are some things to highlight about San Antonio that are, you know, what I feel like are the best of the benefits of the region overall. I myself am, as I mentioned, not a native of Texas. I ended up in Austin late in high school and college, and then came to San Antonio for medical school, and simply fell in love with not only the community, the population, but the School of Medicine and the training programs and the culture of them is really what spoke to me as a pediatrician, as somebody who at the time was very invested in primary care. I am still in primary care, but in the hospital base, so I'm a hospitalist. But nonetheless, I'm excited to have you guys here and happy to answer any questions you may have about San Antonio. Is that my time, or was that a blip?
That was a blubber. I'm sorry.
That's okay. Just trying to be mindful of the nonverbal cues. So just a couple of the highlights really for us. So I would tell you that our program is, because we are in the mid-size range, that's a very intentional choice for us. We stay there because it very much suits our ability to individually tailor the education of our residents. We have a lot of folks who come to our program and come to San Antonio very, very engaged and committed to primary care and advocacy because of the population of patients that we take care of who are by definition underserved and have unique needs. And our residents become very well prepared in caring for those patients, both in their medical home as well as in their high acuity periods in the hospital. They're very resourceful. We have a strong tradition of not just advocacy and evidence-based care, but also in interprofessional collaboration. So working very closely with the teams that help us take care of patients in all those different settings. But I can tell you that despite the fact that most of the people that come to our program talk about primary care, about 45% of them end up deciding to do something in the specialty realm. And that speaks a little bit to the diversity of pathology that we see as a referral base. So we have, you know, all of the big programs, including solid organ transplants. We have a very large trauma, level 3 trauma center here. We have a tremendous number of unique subspecialty services that our patients who, again, as I mentioned, are definitely in need, have access to through our program, and our trainees have the opportunity to sample, and oftentimes that results in an interest in specialty care. So very successful with fellowship matching out of our program, nearly 100% fellowship match rate to ACGME fellowships, and that is again part of our ability to sort of individually tailor your time. We're also very focused on making sure we're taking care of not only our patients, but but each other. And so a significant focus on how we, address the needs of trainees as they're transitioning through what has obviously for the last 2 years been extraordinarily difficult circumstances in their training and beyond. But I think really come out with a family connection to the program and to the people around them. Gina has been a graduate and is now, serving on the other side of things. But do you have anything to add, Gina, that you think is important to highlight?
No, I really think kind of being part of that family is the biggest thing for me. So I'm originally from Germany and moved here for my husband and up in Texas, and obviously stayed here because I like it so much. And I think it's really kind of finding that family between like the faculty and the other residents, just kind of fitting in and having friends and having someone, on your like your good and your bad days, and you're going to have bad days in residency, right? To kind of help you out. So I think that's like one of the biggest strengths of our program, really. And that's definitely why I ended up staying here and why I love it so much.
And Gina's a wonderful teacher. A lot of our trainees really like the size of the program and the community with the medical school, because it gives them a tremendous opportunity to practice and teach. And we all know that the best way to learn something is to teach it. So lots of great opportunities for that. One of our program coordinators, Beth Payne-Weisty, was unable to join us tonight, but she works very closely with APPD and also has had a lot of opportunity to help us with innovation in curriculum and developing different opportunities for our trainees to get all of the exposure they need, not just from a medical standpoint, but from an educational standpoint. So if anybody has questions later about our program, I'd be happy to answer those. Otherwise, I'm just pleased to have you guys here and exploring the wonderful community that we have.
Great. Thank you so much, Dr. Arandes, for that great presentation. All right. Next, we have UT Southwestern Dallas, Texas.
Pleasure to be here. My name is Jeff McKinney. Joining me tonight, I've got Andy Yu, who's one of our associate program directors and a former chief resident here, and Kat Bailey. Kat and I started about the same time, a little more than a decade ago here. And, being at this for a while, I really want to point out how impressive it is what your group's been doing, moving us into what I think and hope may be a sustained approach at virtual recruiting. We did it last year. It's different, but I think it's still meaningful. And I think that we connected well with people who fit in really well here. And I really admire what you're doing as a group, because this is probably a more efficient and probably more equitable and just approach. So anything we do to help with that, we're all in. Our task then, shared by both programs and candidates, is to try to find ways for you to appreciate what the character of different programs is, what it's like to work and live there without maybe physically visiting. And so if I were to try to explain sort of core values and areas of emphasis for us, we've worked hard to intentionally teach and cultivate physicians to be good critical thinkers. We've tried to get our residents, I think we've succeeded, to want to understand why we do things at a biologic and mechanistic level. And then also to ask, why not? Why can't we as a state do a better job ensuring our children? Why is there delay in care? How can we as physicians be social activists? And I didn't grow up in Texas, although I've now raised 2 Texans, and it is a good place to do all of those things. In terms of clinical manifestations of that, we've worked really hard. And in fact, I was reading an article that Andy sent me from the New England Journal about how to teach clinical decision-making and clinical critical thinking. We've thought long and hard about how to try to weave that into almost everything we do. This is aided by, in Texas, you get to see patients that maybe you've only read about in med school, including me, and I've been at this for a while. I still have patients who have to go back to Robbins and Cotran and look up the pathophysiology. That makes our efforts to try to teach people to think about things like mechanism and biology really stick, because it's not just in a book, it's that kid and it's that family. And we've loved that here. Socially, We've tried to cultivate our residents to be physician activists and physician leaders. This includes really intentional collaborations that we've tried to pursue with community clinics, with civic partners, and with local organizations. And I think one of the legacies of a program director's job is who steps in to fill your profession after you leave. And I couldn't be more proud of the people that we've been able to work with. And then given the challenges of the pandemic, you're really a special group. And we think that the creativity and resilience and innovation that you've taken to this process is only going to cross apply to the sorts of things that we're focused on here, like critical thinking and social activism. So I'm going to turn things over to Andy. I saw he was on the line. He's helped design many of the things that have now become normative behavior for us. And I think he can explain what we're doing and why extremely well. So Andy.
Thanks, Dr. McKinney. Hi, everyone. My name is Andy Yu. I'm a pediatric hospitalist, one of the associate program directors, and a graduate of the residency program here at UT Southwestern and Children's Medical Center in Dallas. It's such a pleasure to be able to talk to all of you. Thank you guys all for coming to hear about all the wonderful programs in Texas. Just to piggyback off of Dr. McKinney, I just wanted to take a moment to add and talk about two sort of unique facets of our program that might be of interest to you all. One is about our X+Y schedule, and the other is about living in Dallas. So we are now in our second year of X+Y scheduling, which is sort of a new system, a new scheduling system for us, in which we batch inpatient rotations and then outpatient experiences. So we are on a 6+2 system, or 6 weeks inpatient followed by 2 weeks outpatient, and that alternates. It's new. We've just finished our first year with it, but I think it's been a major success. We thought about why we wanted to do this, and some of the things that I think we have noticed are that I think we have created a more immersive experience in both the inpatient and the outpatient realms, with fewer midday transitions of care. We've gotten the opportunity to actually increase our outpatient training time, and we've built in some new innovative experiences, such as a protected academic half day. And then the feedback that we've gotten from our residents, in addition to that, is that the sort of predictable landing pads, if you will, between inpatient rotations have been really helpful for resident well-being as well too. So that's new. We're still working on things, but that's something that we're quite proud of, and I think it's been going along well. The other area I just wanted to touch on is our home, which is the North Texas metropolitan area. So as many of you all know, the Dallas-Fort Worth Metroplex is very large, rapidly growing, over 7.5 million residents. It's the 4th largest metro area in the country. What some of you all might not know, it's an extraordinarily diverse area. I think the most recent 2020 census data shows that DFW is now one of the major US metro areas that is majority non-white. And that's evident in the patient population that we care for, the makeup and the neighborhoods of the city and the surrounding areas. And then I can also attest from my personal experience, I guess, living here now for 11 years, which is a little hard to believe it's been that long after moving here from New York City, that it's a great city for young professionals, young families. There's a lot of different living options suited for different lifestyles. So there's downtown high-rise living, urban townhomes, single-family homes, a lot of different unique neighborhoods with their own distinctive feels. So the cost is unfortunately getting more expensive every year, but it's still far lower than comparably sized cities on the coasts. So with that, I'll wrap up to be mindful of time. And if you'd like to learn more about X+Y or life in Dallas, we're happy to answer questions. And then I'd encourage everyone to chat with our residents in the after-hour session. Thanks.
Thank you both so much for that great presentation on your program. All right, next. Oops, see, it's taking me back. Bear with me, y'all, I apologize. Last but certainly not least, we have UT Austin Dell Medical School Pediatric Residency Program.
Awesome, thank you, Jocelyn. So my name is Karthik Palupa. I am one of the associate program directors, and I am a pediatric nephrologist, and I'm from California originally, and there are many Californians in Austin, and my wife and I have been here since 2012, and we absolutely love Austin, and we absolutely love Texas, And, you know, I'm making a big plug for all the programs here in Texas. They are really awesome. So, you know, so what's kind of fun and exciting about Austin is that we are a rapidly growing city. So our population expanded by about 20% in the past 10 years. And we have a very new med school at UT Austin, which is the flagship public university in Texas. And with this expansion in population, our city and our hospital is seeing a lot of change. So we are undergoing a major hospital expansion where we really had a big push in cardiovascular health. We added a cardiac transplant program last year. We are adding a kidney transplant program very shortly. And we just opened a specialized delivery unit for infants with high risk medical conditions. With this expansion, even though we're really excited to have all of these complex programs, it's really important to us that our residents still come out as well-trained general pediatricians, either set for a career in Gen Peds or in fellowship. So although we have a lot more services and we are expanding our hospital significantly, it is really important that the core education for our residents is really unchanged. Last year, we welcomed a new chair of pediatrics, Dr. Leah Harris, who was previously the chief of critical care medicine at Lurie Children's. And she has been a really fierce advocate for our residents and our learners. We are expanding our fellowships where we just, so we are opening our NICU fellowship this year, and we're going to be opening PICU the following year, even though we're really excited to add to our complement of fellowship programs. We also like the fact that we don't have a ton of fellows, so our residents still have a lot of autonomy. Like Dallas and San Antonio, our geographical area is incredibly diverse. And right now, Austin is seeing a lot of growth. There's a lot of expansion in tech, and there's a lot of wealth. But along with this, there are a lot of challenges. So we have a population that's seeing a rapid increase in the cost of housing. We don't really have a public transportation system. So for our residents, they're able just to witness firsthand the opportunities and the challenges living in a city that is really changing rapidly. Like Dallas, we have a X+Y schedule. We finished our fourth year of this schedule. We have a 3+1 schedule, so it is 3 weeks of inpatient and a week of outpatient. And we have also seen a lot of positive experiences in the continuity clinic and in terms of overall wellness. We're really excited to have a dedicated advocacy curriculum, which for us is very important, being in Austin and being in the state capital. And like other programs, we have about a 50-50 split in Gen Peds and in fellowship. Our med school also offers a specialized track in value-based care. And we also offer formal resiliency training as well. Austin's a really pretty city. There are lots of lakes and rivers. We are known as the live music capital of the world. Obviously, this past year, that's been a little bit on a hold. And for residents and their families, this is a really great place to not only train in, but to also practice medicine in as well. And we are having we're having a info night in a couple of weeks. So if you are interested just in learning more about our program, you can it's going to be posted on our social media.
Great, thank you all so much. fumbled through the slides, but we got to the end. All right, so now we're gonna have our Q&A session. Our executive director, Tyler Bruinsma, is going to be the one kind of coordinating that. And feel free to still ask your questions in the chat box. And also you can tweet us at hashtag FPR webinar for those questions as well to keep the conversation going.
Awesome, thank you, Jocelyn. So I wanted to start with just a couple of questions that are a little more program specific, or at least Texas specific. So the first one that I saw that came up was, how can non-Texas residents, especially those from throughout the US, but also internationally, show interest in Texas programs? And do you look at in-state applicants different than out-of-state applicants?
I can take that for a second, at least. I certainly I can tell you, we talk a lot about the diversity of the population, and I think really the only way to embrace healthcare equity is to pursue a diverse workforce as well. So I would tell you that I think most of the programs in the state, although we do have a large pool of local applicants, like I mentioned, still explore applicants from all over the United States who demonstrate an interest in the training program and the opportunities that they bring. So I for sure, believe that at least within our own program, we definitely are not limited to the state of Texas and not limited to the nation necessarily. And so we embrace those individuals who have shared values and interests, and that we feel like we'll have a great opportunity to fulfill their needs and also meet the mission in our community and in our hospital. But I'm sure the other programs also want to weigh in.
I'll go ahead and go next. So I'm an infectious disease guy, so I'll frame this using ID as just one example. But it's a beautiful thing when you have a patient who presents with a potential infection, and you've got people in your program who can in turn say, well, I've seen Lyme disease, or I've seen dengue, or, after the dengue gets better, there's a rash, and that's actually encouraging, not frightening, if it's the right kind of rash. We love that. And in fact, Texas, I'm speaking as an outsider, so if any of you are natives and I get this wrong, please correct me. It's really interesting because it's a place that's proud of its history, and at a medical education standpoint, it lets you be really creative because there's a Texas medical board, so you can set up fellowships that don't even exist with ACGME yet in this state. So it's entrepreneurial, it encourages that. I have not found it to be insular, and in fact, I remember soon after we moved here, we were trick-or-treating, and I said to this mob of parents and children, who's from here? There's really only one person in the entire group that had grown up in Texas. So there are a lot of people coming here for various reasons. So no, state of residence does not matter to us, although I've also learned to ask patients, how long a drive do you have home? And, Texans will say, oh, it's only 7 hours. And, then I'm like, well, you need to stop somewhere if you need help. And so, we're not anti-Texan, and it helps to learn the geography and the customs and the culture. But no, this is not a state that has any desire to not attract people from all over.
Awesome, thank you for those answers. The next one that I wanted to bring up was kind of directed specifically towards the San Antonio program, but something that was mentioned was that it's a more tailored program, being a little bit smaller. You could kind of tailor the residency program a little bit more to individuals' interests. So could you talk a little bit more about what that actually looks like for your residents?
Yeah, certainly. So one of the things that comes with being a mid-sized program is not necessarily having, a huge number in each class, so that very solid sort of rigid tracks are, not likely to be populated every year if you have too many of them. So in light of that, despite the fact that we have a variety of subspecialty areas very well represented both by our faculty as well as our patient population and the services are offered, what we try to do is get to know the trainee a little bit. We have a dedicated faculty advisor program. We try to really start talking to them early on about their interests and allowing some elective choices as early as their intern year to explore and sort of answer those questions they may have about what they want to see. This has been especially important in the last couple of years as folks coming out of their medical education have seen a little less and been exposed to a little less, perhaps because of the changes to their clinical experiences. And so really it's about having the ability to be a little bit more nimble about letting people, change their minds and then connecting them with the right mentors, ensuring that they have the opportunity to do that research or educational work that they like to do, having a really nice ratio of faculty to residents that allows those relationships to develop starting very early and then sustaining through training. And really anybody who tells you that there isn't a fair bit of networking that has to happen in almost every field, subspecialty field in pediatrics is not telling you the truth, because it definitely is important to sort of explore those channels and connect with people. And so I think the size of the training program, so we do have, a substantial number of electives that the residents can elect or choose rotations based on their career interests. We allow them to have a little flexibility in what kind of scholarly work they pursue as a result of those choices as well. So again, ensuring that we're preparing them for fellowship tracks if that's what they're going to do. But if they're going the general pediatrics or primary care route, they can focus more on advocacy or education as well. Although everybody is exposed to a core curriculum longitudinally of advocacy as well as QI and so on. So again, the baseline is there for everybody, but just being able to be a little bit more nimble in sort of adjusting tracks. So we've been really successful, as I mentioned, in fellowship matching. And that includes individuals who change their mind, as late as, the imminent summer of their third year where applications were going in and they had a sort of change of heart. So again, I think that speaks to those relationships and the ability to really nurture their interest and their networks in those areas. I don't know if that gets to the question. So variety in the things that they can be exposed to through individualizing their curriculum and their rotations, as well as mentorship and early networking.
Thank you so much. So you actually kind of brought up a piece that I wanted to bring up in the next question. This was a question from Twitter, was how involved are your residents? And I think each program can answer this one. So how involved are your residents in state organizations that are advocating like TPS? And do residents get any dedicated time, or can they ask for some dedicated time for advocacy efforts or for attending conferences?
Yeah, so in Austin, we have a very active advocacy interest group. We have residents that are at the leadership level with the TPS. Our residents, like other programs, are really active during Advocacy Day at the Capitol. They've actually built some advocacy podcasts as well, and they're really active at both the local, state, and national level. I think one thing nice with the X+Y schedule is that our schedule has some admin time built in on those Y weeks, so the residents have some ability during those Y weeks just to be working on advocacy projects during that time.
Advocacy is one of the things that made me become a pediatrician, as opposed to perhaps an internist. Not that they don't do advocacy, but I mean, it's just baked in for us. And the TPS partnerships between different residency programs, transfers with electives to different places, the AAP, you can really immerse yourself in advocacy here. And indeed, it's interesting to learn strategy and tactics in terms of how those groups work together to be the most productive. My program director sent me to the Children's Defense Fund for a training session, and I feel like I'm paying him back by having our residents really become hardcore advocates and activists. There's a lot of that in Texas. And I mean, just be completely transparent, we need a lot of it, right? And so if you want to try to make a difference in a place that needs it, Texas is a great place to come to be an activist.
Agreed. Yeah, and not to belabor, like I said, I think we all share similar things. The TPS is a really wonderful organization to help garner some of those resources and opportunities. The day at the Capitol, we have TPS reps who speak to what the annual meeting topics for trainees are going to be in, and almost every year there's a substantial focus on advocacy opportunities. And several of our residents have chosen, advocacy as a focus of their academic electives, as well as their projects and the things that they do with scholarly work. I say the same thing, Jeff, that, advocacy is sort of baked into every single encounter in our patient population. So what you are doing every time you deliver care is advocating for your patients, whether it's as simple as how are they going to get their medications to how are they going to get back for a follow-up. And so our longitudinal curriculum sort of exposes people to those challenges and the local resources and gives them some community-based exposure and experiences associated with those resources during a variety of different rotations, which is a great way to sort of build that foundation and then allow you to ask the question of what else you would like to see change. So.
Awesome, thank you. So the next question that I wanted to pull up, and I want to read it word for word here. So here we are. So Texas is kind of known probably across the country as a state with a lot of Spanish-speaking folks. So do any of your programs offer Spanish courses for your residents, or do you recommend any Spanish courses to residents interested in learning that prior to starting in your programs?
Yeah, so we definitely don't require our residents to know Spanish beforehand. It is obviously really helpful in Texas. So in Travis County, the Medical Society, which all our residents become members of, they do offer Spanish language classes at a discounted rate. And I would imagine that medical societies in other cities in Texas have similar programs to that.
Yeah, our medical school does have some opportunities as well for Spanish immersion in San Antonio. Again, it's certainly, I think some people assume you have to have it, but definitely Gina can be my perfect example of not needing Spanish and being an amazing practitioner. Interestingly enough, my chairman has tasked me with ensuring that our residents have access to medical Spanish immersion in the next academic year and beyond. So San Antonio will, in some way, shape, or form, have that for sure. But I think there is definitely, for me, it was part of the joy I felt in being able to do something meaningful before I knew much about how to actually medically take care of patients, was using my Spanish background. But definitely it's not a rate limiting step in any way. And there's always, wonderful opportunities to learn, and learning from your patients is occasionally the best way to do it.
I wish I spoke Spanish. Latin seemed a good idea at the time, but I should have learned Spanish. But the fact of the matter is, it's so diverse here that you could ask that question about 20 or 30 other language groups. And so major centers in Texas, all represented here, have excellent translation services and interpreter services. There's even some interesting information and literature that if you think you know Spanish, oftentimes doctors will give themselves more credit with their linguistic abilities than they really have. And so I'd encourage you to work on receptive language abilities first, to pick up subtle conversations, and to make sure before you say that you can really communicate in Spanish to get checked officially. And please just be honest on your ERAS form, because if you don't speak conversational Spanish, we won't send you to Los Barrios, FQHC, but we'll send you other places where you can learn and help in your own way.
Thank you. This question, actually, I want to send to UT Southwestern specifically. There's just a question in the chat about the critical thinking focus in your academic system, and if you could elaborate a little bit more on what that looks like.
Yeah, so it's not just like a single delivery thing, it's every day, but it happens that today we have a resident as educators and leaders conference for our second years. And so right now we're thinking explicitly about what's the transition between being a good intern and being a good senior. And one of the pieces of advice as I was given was I was a new senior, you can probably look up the sodium faster than any of the interns on the team, but your job is to know whose sodium you have to look up. And so, you know, we try to bake that in. And I'm a big fan of pathophysiology because I'm still seeing things that I can't recognize just by pattern recognition. And so I have to go a little deeper about, well, what's going on and what's happening. The Nobel Prizes that come out of our medical school, which Andy went to, make it so that nobody says, oh, that's esoteric. They say, oh, we might get a Nobel Prize for that. And so that's just sort of baked into the kind of geeky biomechanistic approach. But I think critical thinking applies just as well to insurance coverage or to access to mass transit. So, I mean, we really try to cultivate physicians who are going to push back on their own thoughts, on pre-existing diagnoses, on why things are the way they are. And it's pretty important to us.
Awesome, thank you. I would like to conclude for our last question, just with a question to each program. And I thought this was a really great one that came through the chat, was just kind of reflecting back on your whole program. What would you be excited by as an applicant to your program? And what do you think is your favorite aspect of the program that applicants should be getting excited about?
I'm really excited that even though our hospital has really changed a lot, that we're still family, you know, and we've seen a lot of highs, and we've also had just some tough times just with a loss of faculty and other really hard times, but it really is a family, and everyone really supports one another, and that is really, really special to me here.
At the risk of repeating the same thing, I'm actually going to ask Gina, as a more recent graduate, if she would comment on this question, since it's been quite a long time and I might not actually remember what it was like to be in your shoes. There you go.
Sorry, I had to find the unmute button real quick. So I think the biggest thing that we already talked about that I love about the program is just being like having kind of a family here, right? And then I would definitely choose the same program again for that reason, and the fact that we're, I think, a mid-sized program, which is, I think, kind of to add to and to maybe repeat a little bit what we said earlier, but I love that our program can actually tailor the education to each single one. I think one of the examples that I like to give is that I actually, I'm interested in ultrasound. And a lot of the faculty here found out about that. And I actually had two separate people connect me to an ultrasound instructor here, then got hired as faculty. And the first thing that happened is I walk into clinic and one of the nurses says, oh, did you hear? Our clinic director used to work in radiology. If you want, I can connect you. And they know a lot of ultrasound instructors. And that's the kind of program we are. People actually care, and people know the individual. So I think those are the biggest things.
Absolutely. Yep, and we are excited as well to be building another expanded facility for children, women and children's attached to our current facility. So lots of opportunity for growth. I think the other thing that is really key is just recognizing, like Dr. McKinney said earlier, you want to see the whole breadth of pathology while you're in training. And most of those really worrisome cases you hope never to see again, but you definitely need them to be part of that critical reasoning and decision-making, and you need to have that frame of reference. And so I think it's critically important, and I think it's a valuable experience for our trainees who get to see what I love about our program is we see a ton of undifferentiated pathology because we're a safety net. Patients end up here and they don't come as a referral, they come from the border, occasionally with a scribbled note, from somebody on the other side that says needs a workup for something. And so our residents really get to go from point A all the way through the longitudinal care that they get once they have that unique diagnoses. And I think there's just nothing that replaces that experience in your training and in your ability to be, fully capable once you move out of training.
I think the nicest part of my job is writing letters of reference, because it allows me to look and see, well, what did we think this person might do? What did they do while they were here, and how does it prepare them for the next step? And we've learned to really trust our residents. Actually, Andy was a chief the year where we said, we've got about 50 separate electives. Maybe we should take models from colleges and have like a course booklet. Even more gratifying is some of those electives have turned into programs. If you come to Texas, you may be surprised, you may never leave because you don't have to. I don't have to recruit people and think you're going to have to leave at the end of this, because we need good doctors in this state. So our complex and chronic care program started as an elective for an intern, and she ended up running it. And so that's great. And you're going to get that in other places, but you get it over and over in Texas. It's really fun.
Awesome. Well, thank you everyone for sharing all this wonderful pieces. I'm sorry we couldn't get to every single question, but I think many of these programs are going to be on Instagram and Twitter, and all those places are great places to interact. And their contact information is also on there.